Okay, so now you're probably really excited because we're going to get started learning about hormones and endocrine system. I want you to realize we've already learned about some hormones that are unrelated to other endocrine glands. For instance, when we learned in the brain about the pineal body, that's where melatonin was released from, which had to do with your sleep-wake cycles. Also in the thymus gland, there were hormones there that had to do with the maturation of the T cell precursors to become T lymphoblasts, T lymphocytes. And in the kidney, we already learned about erythropoietin being secreted from there and its role in erythropoiesis. So where are we going in this slide? Well, it's not very exciting because we're going back to old territory. We're going to talk about calcium homeostasis. And so the slides should look familiar. I'm just going to review the two hormones that are responsible for calcium homeostasis. So as you recall, when calcium levels are high and we need to tone it down, we're going to use calcitonin. And that comes from the thyroid gland, specifically these cells that are not part of the follicle, but these blue cells on the outside, which were the C cells. So when calcium levels rise above the set point, the thyroid gland is going to release calcitonin, which will cause the blood calcium levels to fall. And remember, it's like a three-pronged approach for calcium levels to fall. It's going to cause increased calcium loss in your urine. It's going to stimulate osteoblasts to deposit calcium from the blood into the bone, and it is going to inhibit your osteoclasts, thereby preventing bone breakdown so you will not release any calcium. We won't have any bone resorption. In contrast to the thyroid gland and calcitonin being stimulated with high blood calcium levels, that's the stimulus, don't just say calcium, high blood calcium. When we have low blood calcium, we are going to stimulate the parathyroid glands to secrete parathyroid hormone. And so osteoclasts then become super active because they have parathyroid hormone receptors, and so calcium gets released out of the bone. Osteoblasts become inactive. The kidneys, instead of secreting calcium in the urine, will reabsorb the calcium back into the bloodstream. And we will also have increased calcium absorption in the kidneys because we are going to have activated vitamin D, allowing us to absorb dietary calcium. So picture once again with both the yin and the yang for calcium homeostasis. I want to point out calcium levels are high, thyroid gland, calcitonin. Calcium levels are low, parathyroid gland, parathyroid hormone. And neither of these hormones involves any other organ. There's no hypothalamus, there's no pituitary, there's no other organ. And so I'm going to stop on this, and I promise you on our next video, we will be getting to new material.